My name is Robin Perry. My op-ed presentation is on Medicaid coverage of doula services. So the issue I'm looking at is that most states do not currently require Medicaid to cover doula services. There's actually 10 states that require Medicaid to cover doula services, and they all have different requirements on what a doula is and what really that covers. This has led to a lot of people from lower income brackets not being able to access doulas because they're really more of a privatized option for your birth. So what I look at next is what is a doula? They're a non-medical professional who offers birth education, emotional and physical support. So they're there to help decrease stress for the person during their pregnancy, labor, and postpartum. And they are there to help you understand what's going on and be able to effectively communicate with your medical professionals. This is especially important for people who have not been educated in medicine, who may have a difficult time communicating their needs to their medical professional, and then help them feel more listened to. There are many pathways to becoming a doula, the most prominent one being a certification through DONA International. They're one of the largest bodies for certification as a doula. There are a lot of other ways to be certified to be a doula, though, which is where you get some of the criticisms. There's no standardized education, there's no accreditation for these groups that are educating people, and that's led to them being seen as an unprofessional or paraprofessional group. And as a result, there are doctors who do not respect doulas, and they can at times become adversarial to each other instead of working together as a team, which is really what you would want out of your doula and your doctor. And there have been some cases where their improper training has gotten in the way of medical intervention mentioned in some of the articles that I read, especially the Collins article went into some cases where the adversarial nature between the doctor and the doula was creating stress for the person giving birth. So my argument for doula coverage would be that support during labor, such as access to a doula, has been shown in the studies I looked at to lead to shorter labors, decreased likelihood of needing a C-section, and having a preterm birth. Those are all things that can lead to short and long-term health outcomes that are obviously costly for the state and costly for the person, both economically and to their health. A preterm birth can lead to lifelong health complications for the infant and is incredibly stressful for the family. And some studies have shown that covering doula services could save the state money in the long run as a preventative measure, because obviously a stay in the NICU and long-term health issues for someone would be far more costly than just a doula. And they also have been shown to, at least from the people surveyed, they feel safer, more supported, and respected both personally and culturally, especially if the doula is matched with them culturally, and that helps them have those better health outcomes. And I also think that it would help legitimize doulas, which would help medical professionals respect them and help them build relationships with these medical professionals so that they could work together as a team more, especially because then the medical professional can focus on what they're doing and the doula can focus on being a support person. So I would propose state and national levels legislation. States should pass legislation to require Medicaid to cover doula services, and they should make sure, a few states have to include what kind of education to be required. But then, because the studies I looked at also said that it's important that they're culturally matched with expectant parents, they should include programs to help immigrants and people of color complete doula licensing, so that they can be there for the most disadvantaged groups that obviously need support from people from their own communities. The rate of mistreatment among African American women in the VIDM et al. Article we read from medical professionals was 27.2%, and they are 3 times more likely to die during pregnancy. Obviously, we want them to be supported. And then a federal level mandate for Medicaid to cover doula services would also be possible, obviously harder than going state by state and then eventually reaching national level and being able to standardize it across all of the states. And here's my references.